Assalamu alaikum. Welcome all to Easy Human Anatomy channel. In this video, I discuss anatomy of the posterior of external jugular venous pressure. Understanding the anatomy of the external jugular vein is essential for measuring jugular venous pressure, surgical procedures, and venous access, preventing injury during neck surgery. The rise jugular venous pressure is the sign of congestive heart failure, cardiac tamponade, fluid overload, pulmonary hypertension, or superior vena cava obstruction. It is used for vein access during emergency when other veins are hard to reach, like during cardiac arrest. External jugular vein is frequently used in head neck surgery, microvascular surgery as a recipient vessels for free flaps. At first, the anatomy of the external jugular vein. It formed by the posterior auricular vein and posterior division of the rectomandibular vein near the angle of the mandible within the parotid gland or outside the parotid gland. It's run over the sternocleidomastoid muscles and drained into the subclavian vein. This is sternocleidomastoid muscle and this is external jugular vein. Variations. Understanding the anatomical variation of the external jugular vein is crucial for surgeons to avoid complication during invasive procedure in the neck region, such as central venous catheterization, tracheostomy, and neck dissection, and also it's important for measuring jugular venous pressure. It may be absent unilaterally or bilaterally. It may be duplicate. It may be three parallel external jugular vein draining into the subclavian vein. It may drain into the internal jugular vein instead of subclavian vein. External jugular vein may receive tributaries from the transverse cervical vein, anterior jugular vein, supraclavicular vein, and superficial cervical vein. In fetus, duplication of the external jugular vein on the sternocleidomastoid muscle was observed in 4% of the specimen. So these are the all variation of the external jugular vein. How to measure external jugular venous pressure? At first, keep patient face straight. Why? If patient turn the head to the left actively or passively, it make the external jugular venous pulsation wave hard to see. Why? Because the left lateral rotation of the patient neck make contraction of the sternocleidomastoid which compress the external jugular vein and so it is hard to observe. Identify external jugular vein in living body. And it is start from the near the angle of the mandible and it's run diagonally over the sternocleidomastoid muscle and near the clavicle its end. Sometimes it's difficult to see, so at that time Valsalva maneuver may help to visualize the external jugular vein. This is the venous pulsation. If you carefully see, you see double wave. It is arterial pulsation, single wave and quick. So be careful about identification of the venous pulsation and arterial pulsation. The position of the patient is 45 degree, and how to measure the jugular venous pressure. Use a ruler to measure the vertical distance between highest point of the jugular venous pulsation and the sternal angle. In this case, you add 5 centimeter, which is the approximate distance from the right atrium to the sternal angle, where the patient is at a 45-degree angle, to measure the vertical distance. The total should be reported in centimeter of water. So normal range of the jugular venous pressure 6 to 8 centimeter water, elevated jugular venous pressure more than 8 centimeter, and low jugular venous pressure is less than 6 centimeter water, which may suggest hypovolemia. So this is all about today's presentation. If you like this video, please press the like button. Please subscribe my channel. Thank you for watching.